Welcome to Meet the Docs with your host, Grant Otten, brought to you by Columbus Community Hospital.
Welcome to another edition of Meet the Docs here on News Channel Nebraska and Columbus News Team, brought to you by the Columbus Community Hospital. I'm here with Dr. Krueger, and, well, before we get started, tell me what machine we are standing from so people at home know what's going on.
Yeah, this is a CT scanner, also known as a CAT scan.
So what, I guess this and an MRI machine are two different things, but both stuff that you work with. Can you kind of walk me through those two machines?
Yeah, sure. CT scanners uses radiation and helps kind of see the body, the inside of the body, kind of like you're cutting a loaf of bread into slices, so you can kind of cut through your body and see different areas and different anatomy in the chest or abdomen or pelvis or any extremity.
Cool.
MRI does the same type of thing, except it uses magnetic resonance to actually identify anatomy and pathology in the body.
You talk about you got signs outside of the thing. You can't have cameras or anything metal really going into. So, I mean, how strong is that magnet that's in there?
Yeah, it's a very strong magnet. We're actually in the CT side of it, so we're not over on the other side by the MRI. But yeah, that magnet's really strong. It can pull something right up into it.
So on a day-to-day basis, what is it that you do here at the hospital?
So I'm a radiologist, which is a doctor. We specialize in diagnosing and treating diseases and injuries using imaging guidance, being the CTs, the MRIs, the ultrasounds. So we can we look at all those images and make a diagnosis, and then let the patient and physician know what's going on. And we also use those same machines to do certain interventional procedures such as biopsies, drains, injections, things like that.
Can you walk me through what the educational process was for you? What was your journey to get to this point?
Sure. Yeah. I grew up in South Sioux City, Nebraska, so I went to high school there. Did my undergraduate in Nebraska Wesleyan in Lincoln. And then I did a medical school at UNMC in Omaha. Did a year of internal medicine, also known as a clinical year, at Creighton, and then finished my radiology residency at UNMC back in Omaha.
Is this something you always knew you wanted to do, or when you were doing your different studies, is it just kind of a slow process to get here?
It was kind of just, well, when I was going through medical school, I kind of just wanted to test out all the different specialties, rotate through them, kind of see what I liked, what I didn't like about stuff. And toward the end of my medical training, I really liked my radiology rotation and being able to see multiple numbers of different patients and or scans every day and diagnose things that way.
Cool. So do you stay pretty busy here in Columbus? Do you like your time working here at the Columbus Hospital?
Oh yeah. Yep. We're stay very, very busy here. So especially doing all the CTs, MRIs, and also some of the procedures that we do, it keeps me very busy.
And I hear you guys go on the road a little bit to check out different machines, and you guys are heading to Chicago here. And so, what's the difference between maybe checking out? So, why do you need to go visit and check out these different types of equipment?
Yeah, we're going to go check out another MR scanner. We're going to check out an MR scanner, an MRI, and so we got to go to these sites to look at all their different images, kind of see what the quality of the images are coming off those scanners, and see if that's something that we'd like to purchase.
People might wonder, when would I need to come get in a machine like this? Why would I need to come here? What's the kind of the situation where someone might end up coming down here?
Yeah, it's a wide range of things could lead you into a CT scanner. A lot of the stuff we do is out of the ER. People come in, falls, headaches, pain, trauma. They get a car accident or they twist some body part and need a scan. Other times we do it for screening, like lung cancer screening. We do a CT of the chest to look for lung cancer. Could be for oncology. If somebody has a tumor or a cancer, we can follow up their imaging that way. So.
Well, hey, I appreciate you sitting here and talking. Or standing here and talking with me, explaining to me a little bit about these giant machines we got in here too. So it's very cool. Dr. Krueger, appreciate it.
Thank you very much.
All right, guys, thank you for tuning in to another edition of Meet the Docs here on News Channel Nebraska and Columbus News Team, brought to you by the Columbus Community Hospital. We will see you guys next time.